All right, let's talk about body regulation, body temperature regulation. What does your body do to keep you warm? There stands. Good. Yes. Shiver. Muscle contractions, right? That actually produces heat. Sir. Goosebumps, which remember that catches that layer of air, that small layer of air, and helps you warm it up. Sir. The what now? Okay, so instead of your blood being toward the surface, it constricts those blood vessels on the outside and pushes it more towards your core where it's warmer, right? You stop sweating, right? Good. So these are all ways your body tries to keep your heat in. Because remember, we have a fairly narrow range of temperature that you and I like to hang out with. And I'm not just talking about being comfortable. I'm talking about like actually living and dying. The top range is, I don't know, 106, 107. That's a pretty top. If you're up in that range, you are in serious trouble. If you're down around that 90, 89, and we're talking about Fahrenheit, of course, you're in trouble. Like, you could die if you don't get the temperature up or down in those ranges. Okay, so what else? If I'm cold, what is your body going to do to oh, sorry, that was just, we just did getting you warm. What if you are too hot? What's your body going to do?
Wait, if you're like in like the 90 or whatever, can you just like sit by a fire?
Sure, you can warm yourself up a bit, sure. That's one of the ways.
Yeah, actually help.
Sure. Yeah, it's producing heat, so you're warming yourself up, yeah.
But what if you can't maintain that? So the second you leave the fire, would you get cold again? Or?
Well, again, normally your body is able to, like, it's not that immediate kind of thing. So think about if you've been out skiing and you're just super cold. You're going to come in, it's not going to be an immediate, I'm good. It'll take you a while to warm up. But once you get warm, your body will usually be able to stay that way. Yeah. All right, so we talked about you're hot, right? Now you're cold. What's your body going to do? No, I'm sorry, again. The brain's not on today. So the one we haven't talked about yet. What's your body going to do next? You'll sweat, right? This is trying to cool you off. You're going to sweat. That's a big one. What else?
The blood vessels are going to relax, so there'll be more blood circulation, which will let the blood release.
Okay, so it'll send blood to the surface, right? Where are big places that happens? Your face is a great one. Okay? Where else? Sir? Your hands, palms of your hands. This is a great place. You want to get get cool very quickly or get warm? Hold on to something very cold. You will cool down very quickly. They actually have these things in the NFL where these guys like literally put their hands inside and they grab onto this piece that's really cold, this like metal thing that's really cold, and it cools them off very quickly. It's a very cool thing. What else? Sorry, one more thing before we get to the question. Where else is lots of blood vessels? So face, hands, feet, palms of your feet. We don't think about that because we mostly wear shoes all the time. There's a great saying in hiking, in camping. If you're cold, put on some socks. If you keep your feet covered or your head, those are the two places. If you put on socks, you put on the hat, you can roll. Good. So these are, again, we're talking about just places where you lose heat very quickly. Your head, your hands, your feet, your face. Your question, Joshua. Thanks for being patient. It depends. There's not necessarily, usually the heart will start beating faster in both of those conditions, if you're hot or if you're cold, again, for different reasons, to pump the blood different places. But usually it will elevate a bit, not necessarily depress. If you're super duper cold, yes, then the heart's not able to work as well and you will slow down, yes. What else does your body do if you're cold? Yes. Oh, sorry. What the question?
How does the blood coming to the top of your skin, how does that move?
It's a great question. Because we're not like leaking blood out of our skin. So at least we hope not. How does that help you to cool off? This is a very valid question. Anybody? How does bringing the blood to the surface, again, to your hands, to your face, to your feet, how does that cool you off?
Well,
Okay. Okay, move her away from bringing the blood away from the core so that helps cool you down. That's a good plan. I like that. Any thoughts? Are you comfortable the outside of your body is the place where the air is contacting it? Right? I mean, look at right now. What parts of me are uncovered? My hands, my face, my head, right? And most of you, that's the same, right? So these are places with easy contact with the air. So that therefore the heat that's in my hands here, I can start warming up the air right around me. Don't actually touch your face, but just put your hands. Can you feel the heat coming off of you? Like I'm warm right now, so I can very much feel the heat coming off of me. Right? So I'm actually heating air around me. So bringing that blood closer to the surface, what I'm doing is I'm heating the air around me and getting the heat off of my body. Does that make sense? If I sweat, now that sweat is going to evaporate, and that evaporation actually cools my skin. It's called evaporative cooling. That's the whole technology behind Under Armour, these kind of shirts. The point is that it wicks that sweat away from your skin. Well, who cares about that? Well, as it then evaporates, it cools you off. That's the point there. And cotton doesn't do that. Cotton holds onto that moisture very, very tightly. Then you're in trouble, right? Because you're not able to really get it. That's why on these days when it's just super hot, right? It's 90-some degrees. The air is so humid. These are terrible days, right? Because you can't evaporate sweat because the air is already saturated, right? And the temperature is about the same as your body. Ugh, I mean, you might as well just die. You know? That's my worst nightmare. I don't like being super hot. Give me that like 60, 70 degrees.
Yeah, same expensive.
I'm there. So what if you can't sweat? And there are actually people who have defective sweat glands. You might say, well, that's nice. I never have to wear, antiperspirant. But you have a very hard time staying in that narrow range of temperature. So you'd have to be very aware of not being too hot or not being too cold. Yeah. Other questions? There are 2 or 3 other hands. Did I answer them already? Please. Botox stops you from sweating. I guess I wasn't aware of that. I would say it must block those receptors in some way. I have to look that one up. I don't know enough about that to answer that. But again, the sweating is there for a reason. You know what I mean? So while I'm comfortable covering up the smell of it, maybe not the best plan to totally stop that.
What about people that have sweat like way too much?
Sure. Now that would be something you may want to have something that's in between. Yeah.
How does that affect that? Does that make you just cold all the time?
Sure, he could be. Yeah, certainly.
They have this new thing because my mom had like a coworker whose son had it done, and yeah, they tried like the Botox thing, and then like it wears off, and so then there's this thing. It's like it microwaves like your armpits or something.
Cool.
Just like kills it.
You're just basically killing the sweat glands.
Yeah, it's
I got you. Again, I would just be cautious about. Well, you would have to think that you're killing those cells. You're trying to target a certain area, but yeah. I don't know really anything about it. I would be a little cautious about that. Just so you don't have sweaty pits. I don't know, that's a tough thing, I think. Are we cool, friends? So you could maybe answer a short answer question about how you stay warm and how you stay cool? Like maybe on a summer assessment, like maybe on Friday? Wait, what? No, I'm paying attention. Healing of wounds. Yes, ma'am.
How in depth do you have to go on heat stroke and how to do it? Because those are both on the
Sure. So there is a piece, thanks for saying that before I moved on. There is a piece on your study guide talking about heat stroke. Heat stroke is there on page 502. What's the difference between just being too hot and actually having heat stroke? I can hear you, sorry. Okay, because that's the key. It's not like we're just hot. Now the body is overwhelmed, like it's just too warm. So you start having signs. Like what kind of things happen? Does anyone know? Headache, dizzy. Significantly high elevation of your breathing rate, your pulse rate. What else? Hallucinations. This is you start seeing things. You don't know where you are. You're confused. Kidney failure, sure. Arrhythmia. This means not beating in that thump 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 thump. It starts messing up. There's another key thing though. You need water. Sure, if you don't get enough water, absolutely, you can have heat stroke because you're sweating it all out. But you actually stop sweating. It's one of those things that people like. If somebody is so hot that they are no longer sweating, they're in trouble. Like that's one of those key kind of indicators because we can't necessarily check for kidney disease just by looking at you. Okay, but that stopping of sweating, cool. How about hypothermia? So that was hyper, too much thermia. How about hypothermia? What kinds of things are happening there? Okay, temperature is dropping below 95. What else is happening? Good. Hang on. She's got a good list here. You all done some homework, and I appreciate that. Stiffening, lack of coordination, right? That whiteness in the hands or feet, where all that blood is being drawn into the core. You realize that's what frostbite is. It's simply that the water in your tissues are freezing. And if you don't very slowly warm them up, the actual cells will burst. They'll die.
But how do they freeze if they're in an environment that's above 50 degrees?
Your core can be certainly... No, you're talking about being colder than that. You're talking much colder than that. For frostbite,
Yeah.
you would have to be in a place that's colder than 32 degrees. Otherwise, the water wouldn't freeze.
Body makes heat so like
Sure, but it's pulled all that heat into the center. All the blood is moving toward the center. So these guys aren't getting very warmed.
oh, so like they could have like
Yeah, because your body will sacrifice your fingers or your toes in order to keep your heart and lungs warm. Yeah.
is that why like if you're like super cold it's hard to like talk?
Sure. Yeah, the joints are stiff, lack of coordination.
So for stroke and hypothermia, we want to know like how the skin is in regulation with body temperature. So how we get it really hot, or like what it is to have stroke.
Sure, you should be comfortable what these guys are and what the signs of them are in general, and then how your body tries to stay warm or how it tries to stay cold. Yep. It doesn't usually take much blood away from your head because your brain needs so much oxygen to do all the things it does. So while I hear what you're saying, maybe the surface level, like the blood vessels here, you'll get pale. So the skin blood vessels, but really not your brain blood vessels. It's a good question. Ears certainly, yeah. These are expendable. We can, sure, yeah. People get frostbite on their ears. Oh yeah. Please.
When I went camping, like one of the first times I went camping, it was super cold, and so the lady that was with us, she was like 80% of your heat leaves to your head, so that's why you have to wear a hat. Is that?
The 80% number, I've seen studies going back and forth on what the number is, but it's a lot. So again, the rule of camping, if you're cold, cover your head, cover your feet. If you got those two places covered, you can be naked everywhere else in your... No, I'm kidding, but yes.
So, for different people, so you know some people can handle the cold.
That's more just a product of what's your general body temperature, what you're normally in, you know, what you grew up with, that kind of thing. Yeah.
So you have to know like the whole age for heat stroke.
No, just general. Just generals.
You know how like have you ever seen people with like an ear like kind of missing?
Mm-hmm.
Could that also be from like a fire?
Could be. Sure, it could have been a burn.
Does your ear just like melt?
Well, I mean, it's just sticking out there. So, yes, with enough heat, it could. Sure. Yeah.
Or it could be frostbite.
Could be. Yeah. Okay. This is good for us just to dive into wound healing now. Let's take a peek there. Sir, please.
With frostbite, like your finger's like super cold, but like why do you have to get it amputated?
Well, because again, the tissue has frozen and the cells have been damaged to the point that they can't repair themselves.
So like you could still have the finger, but it would just not fall off.
Well, normally if the cells are damaged so badly like that, they'll die, and you'll start getting bacteria growing in there. That's what we call gangrene.
Or like,
So it's not the frostbite why they cut it off. It's because of the infection, the gangrene that starts, the dead tissue.
how would it get infected though if it's like enclosed?
Well, often it's not. And again, plus the tissue is just literally dying. So, think about a piece of meat. If you just leave a piece of meat out, it's going to, right? So your infections will start there. Yeah. And the last thing you want is that to get to the rest of the body.
Yeah.
So,
So basically just so it doesn't spread.
exactly. Yeah. Yes, ma'am.
So for the diagram on 156, you wanted us to know, do we have to know all these?
This is on page 129. Most of the pieces there we've talked about.
Because what about tactile corpus?
So these are just the nerve sensory pieces.
But you want us to
Those are just the
label,
nerves.
like-
You should be comfortable with that. Yeah. Those are just the nerves for to be able to feel something. That's just the name of them. We'll talk more about them in the future. But okay, friends, let's talk about wound healing. You want to go to page 137 in your textbook? And I apologize, I don't have this picture to show you on the board. So you'll have to go to page 137. Let's talk about inflammation. Inflammation is what your body does when it's injured. This is a normal response to injury. So what are the signs of inflammation? There's 4 of them. Give me one. One of the signs of inflammation. Give me one. Yes, ma'am. Redness. So an increase in redness in the area. It looks redder. Okay? Joshua. Swelling. You get this increase in size, right? Okay? What else? Heat. It feels warmer, right? And last one, pain. It hurts. So are you comfortable? These are all things like if you were to twist your ankle right now, you would try to avoid those, right? We want to try and reduce the inflammation. Why? Because it hurts. Okay? And what can happen is, let's say I have an injury here like this, right? If I have swelling, if I have increased blood flow to the area, are you comfortable if that's going to push on this tissue around that? Are you with me? Do this for me. On your hand, I want you just to kind of squeeze your hands together really tight. And we'll hold them for about 10 seconds here, nice and tight. You're adding pressure on the tissue, right? When you take your hands off, could you see how white they were? Because you're literally pushing the blood away, right? And then quickly it comes back, hopefully. Right? Here's my point, guys. Shh. Some of you got impressive hands, I can see. When we have swelling, that swelling causes pressure on the tissue around the injury, right? And so we do these things to prevent the swelling, to prevent the inflammation, so we don't hurt more of those tissues. Does that make sense? But inflammation itself is a natural part of healing. So it's a balance. Yes? Edema is swelling. No, it's just another word for swelling. Yeah. It's usually more talking about the actual interstitial fluid, the fluid in between the cells. But yeah, that's what edema is. Edema is edema. It's a long E. Are you with me, friends? So how do we start to heal? And again, I thought that this diagram on page 137 does a real nice job of talking about it, right? So when the blood is injured, when the skin is injured, blood escapes from the dermal blood vessels, and really quickly, what forms? A blood clot. In 20 seconds. This to me is one of the huge things that I realize this isn't a great argument because things we don't understand or that are so complex that nature does and the body does a lot of times. But let me ask you this. Are you comfortable? Are blood clots a good thing in your body? Okay, so if I cut myself, a blood clot is a very good thing, right? It quickly heals and stops the blood from coming out, right? In any other place, is a blood clot a good thing? What's a blood clot in your brain? Does anyone know? That's a stroke. Okay, an aneurysm would be actually bursting, right? How about a blood clot in your lungs? Oh, okay, sorry, these are all good medical pieces. Okay, that would be a pulmonary embolism, where you've got a blood clot in your lungs, right? How about a blood clot in your heart, one of the heart valves, in the heart blood vessels? That's a heart attack, right? Are you comfortable you die from all of those things? Okay. And again, we'll get to that. But the biochemical pieces the body has to go through to know when and when not to produce a clot, they would take up pages to talk to you about how all that works. I have a hard time believing that's something that could have just evolved, or that could have just been over a long period of time, step by step forming. No, it has to be all present. Does that make sense? If the first cell was cut, the first organism was cut, it has to have a way to repair that or it dies, right? So anyway, it's one of those arguments that I have a hard time believing that. Okay, so the blood clot starts to fill it, right? And then what happens next in C? We start sending out, the blood vessels send out the branches, and fibroblasts. What do fibroblasts do? They blast fibers. They blast out fibers. They make fibers. They make these collagen and tissue fibers that fill in that space. Are y'all with me? Do you remember these from our tissue? Should I pull out the box of Kleenex? No. Okay. Yeah, the fibroblasts are the ones that actually fill in the gaps. Are you comfortable the scar tissue you have is not the same tissue as your skin? It's a dense connective tissue that's laid down there. It's not epithelium. So those fibroblasts come, they produce the collagen fibers, and then last but not least, that scab that's been formed protects it until it's replaced, until the area is healed. That's why we don't want to peel a scab off too. You want to let it fall. I hope that was off that whole time. Are you with me, my friends? So, these are the pieces that you should be comfortable with. And again, this would be another short answer type question. Can you explain to me what's happening in this healing process? And again, that's why I'm pointing you right to that picture there on page 137. It's a great, kind of succinct, here's what's happening. There's much more detail than that, but that's the initial piece. Any questions there? If you've got these big cuts, you have something called granulation tissue. I'd show you pictures of that, but I think some people are a little bit queasy as far as, but it looks like this kind of raw meat look to it. It's kind of buddy, very bright red. That's granulation tissue, and that's something as a wound specialist you would get rid of that stuff because you want to keep it clean. All right, last but not least, we're through wounds. Oh, sorry, one more piece on that page is pressure ulcers on page 132. And I got just 2 minutes here, guys, so stay with me. The pressure ulcers, this is dear to my heart because as a physical therapist working in a hospital, this is something I dealt with quite a bit. This comes from, again, think about us squeezing your hands, right? As you put that pressure on your hand, it turned white because the blood couldn't get to it, right? Well, imagine your heel just being placed on the bed and left there, right? The pressure from the bed on your skin moves the blood away. It can't get to that skin, right? And so that skin dies. And you actually have people who will get these pressure ulcers, these places of dead skin on their elbows, on their heels, on their hips, especially people who can't move, like they're in a nursing home or they're paralyzed. You have to always keep moving them. It's literally like every 30 minutes they have to be moved. Otherwise, they develop these pressure ulcers. And they're terrible things, especially because it's somebody who's not moving, so they don't heal very well. So eventually you can actually have people lose limbs because of this, because it's just so bad. Yeah. Okay, so tomorrow we will finish up. We'll talk about burns and skin cancer, and then we'll dive into how the systems interact together. I will see you then.